Hi, we are a group of TWU nursing students presenting on depression in the community. Our names are Bryn, Maria, Nicole, and Stefan. Thank you for joining us. So, what is depression? Depression is a mood disorder that causes persistent feelings of sadness and loss of interest that can impact an individual's capacity to function. Common features include sadness, feelings of emptiness, irritable mood, changes in appetite, and cognitive changes. Our objectives for this presentation today are to raise awareness about depression in any community, to provide education about depression and offer potential solutions, and to build a relationship of trust between nursing, health groups, and the community. Let's talk purpose. So mental health and depression have historically been a taboo topic, but it doesn't need to be. We're here to do what we can to help you help yourself and those in your community by raising awareness of the rise of depression in older adults, learning what depression can look like, and treatment options for depression. We hope to encourage a healthier, happier community. On the screen, you'll see a QR code. This will lead you to 4 pre-presentation questions. As we go throughout the presentation, you'll have an opportunity to see if what you chose aligns with what is taught to you throughout the presentation. I'm going to read the 4 questions now as you answer them on your own. 1, depression can lead to suicidal thoughts or actions. True or false? 2, signs of depression include feelings of depression, clouded concentration, and increased appetite. True or false? 3, who is at risk for depression? A 16-year-old female being bullied at school, a 72-year-old male who is recently divorced, a mother of 3 children that is a stay-at-home mother, or all of the above. 4, what are some barriers to mental health treatment? Please select all that apply. Lack of mental health education, stigma, laziness, dismissing symptoms as normal, or fear of being institutionalized.
All right, so let's talk a little bit more about what depression is. How does it feel and what does it look like? So how it feels, it varies for every person. Everybody's going to feel things a little bit differently, but things that may happen would be persistent feelings of sadness, anxiety, or emptiness, hopelessness, irritability, loss of pleasure and usual interests, such as like hobbies or hanging out with friends, so you just don't really want to anymore. Changes in appetite. This can go up or down. So you could feel like you're eating a lot, or you could just not really be hungry anymore. You can have decreased energy, fatigue, just feeling sleepy all the time. And on the catch to that, there is also trouble sleeping that you can have, even though you are so tired, you just can't sleep. You can also experience aches and pains in your head, your limbs, joints, back, etc. Can also cause some GI troubles and difficulty concentrating. There is actually a WHO study that analyzes patients from 14 different countries, and it found that 69% of people only present with the physical symptoms of depression. So those changes in appetite, the aches and the pains, the trouble sleeping, the GI troubles, things that we don't typically associate with depression, a lot of people, 69% of people only have those symptoms rather than the hopelessness and the irritability and sadness. Now, what does it look like? So how might you recognize depression in somebody else? You may notice changes in their weight. They may be a bit more withdrawn than normal. They could be moving or talking more slowly than you used to see them. They can have uncharacteristic aggression, where you could see a decrease in their productivity. But I do want to stress that you can't always see depression in others. No matter how close you are to them, even people who seem fine can be struggling. So who's at risk for depression? Depression can happen to anybody in all genders, ages, and backgrounds. But there are some things that could increase your risk for having depression. And those include having a first-degree relative with depression, genetics, having a neurodegenerative disease such as Alzheimer's or Parkinson's, those who have had a stroke in the past, those who experience chronic pain, people who they work prolonged working hours, have job insecurity or work-related stress, those who don't go out or see their friends as often as they could, and vulnerable adults with comorbidities.
Okay, so we'll just talk a little bit about the demographic data of our target area that we looked at. Just to get an idea of the population, there were 70,200 people, 53,837 of them were adults, 10,815 were senior citizens with a median age of 38 years old and an average income of $71,076. So interesting demographics of NRH is that the population increased 11.49% since 2010. There's a 62.2% rate of home ownership and a 9.35% of population that hold graduate degrees, which we'll talk about in a little bit. But as far as the racial makeup in North Richland Hills, you have the whites making up 65.7%, Hispanic is 17%, Asian is 4.6%, Black is 6.9%. There's 2+ races, it being 3.1%, with Native Hawaiians 0.8%, American Indians 0.4%, and an other of 0.1%. So the incidence of depression in adults residing in NRH. So if you look on the screen here, we see that adults that were ever diagnosed with depression is at a value of 21.7%. Again, this was last recorded in 2019. Compared to Texas or in the surrounding area, Tarrant County is at 19.4% with a US value of 18.8%. So it's about 2.3% higher than in Tarrant County and almost a total 3% higher than the US value. And we're going to look at that one more exclusively, but just the poor mental health days of being defined as 14+ days of having poor mental health was rated at 13.6%, which was only moderately above Tarrant County value of 13.5% and was actually equal to the US value of 13.6%. So like I said, we're going to look at the overall incidence of the 21.7% adults diagnosed with depression because that's what we're concerned with, that increase, like Tarrant County again in the US being a little bit lower.
So depression can have a huge economic impact. It can be expensive to treat depression, especially for those who do not have insurance. Depression can also cause other health problems such as heart disease, weakened immune system, among other health problems. Now, not only do you have to get treatment for depression, but now you might have to get treatment for all of these other health problems that depression might have brought upon. So this just means that there are some economic barriers, such as having no insurance, that makes people less willing to seek treatment because of how expensive it is. So the goal for Healthy People 2030 is increased depression screening and treatment. So this is going to focus to improve mental health and the quality of life. So through prevention, screening, and assessment and treatment is how we will work towards that goal.
So we just discussed the Healthy People 2030 goals, and now we're going to discuss what's being done to achieve those goals. We have a set goal of increased proportion of adults who get treatment that are experiencing depression. So our target goal for that is that 69.5% of adults with depression would receive treatment. Our most recent data shows that 64.8% of adults with depression are receiving treatment. So we are kind of close, but still have a ways to go. And then we have a goal of increased proportion of primary care visit depression screening. So we're wanting patients to be screened for depression at their primary care visits. And the goal for that is 13.5%. Most recent data shows 8.5% of adults are being screened for depression at their primary care office visits.
The silent killer. So why does depression go undiagnosed and untreated? There are a lot of different reasons, and the reason is going to be different for everybody. Some things that we came up with are low awareness for symptoms of depression. We talked a little bit about how those symptoms don't always look like the typical sadness or hopelessness. There's also the denial that the individual is experiencing symptoms of depression. Again, sometimes the symptoms don't look like we think they're supposed to, and it can be kind of hard to come to terms with. There's a disbelief in mental illness, a social stigma, and a potential for it being very expensive. We'll talk a little bit more about that.
All right, so we're going to talk a bit more about depression and how it can affect our bodies and overall health. There's growing evidence that depression can decrease or directly stimulate the production of something they call pro-inflammatory cytokines. And that's really a cell signaling system within the body where the higher organs will express to the surrounding areas and the body that it's under a state of stress that increases its awareness, but over time causes fatigue. And that will influence a spectrum of conditions associated with aging, including cardiovascular disease, osteoporosis, arthritis, type 2 diabetes, certain cancers, periodontal disease, frailty, and functional decline. And so what we've been what evidence has been implicated in as far as this dysregulation of pro-inflammatory cytokines, they're using these markers as a central component across the range of diseases to identify how this can lead to that decline. Particular emphasis has been placed on a specific cytokine called interleukin-6 for depression and distress, as depression and distress will enhance the production of it. Now, negative emotions may contribute indirectly to the immune dysregulation, evidenced by this overproduction. But the major thing that research has been identifying is that repeated and chronic stress of these cytokines keep the cells functioning at such a high level that they don't have the capacity to spend time back like healing and resting and recouping from that stress. So, what we're seeing is that the depression and that constant anxiety can directly affect the cells of the immune system as well, and can either upregulate or downregulate secretion of further pro-inflammatory cytokines. Inflammation has been recently linked to a spectrum of conditions, many of the ones we named. Chronic inflammation suggested is one of the key biological mechanisms that fuel declines in physical function faster, which again leads to frailty, disability, and ultimately death. Even studies dating back to the 90s are showing a relationship, again, where they're looking at this elevated serum levels of interleukin-6 to predict future disability in adults. Now, it's important to note that while there is a relationship, it's a related to scenario more so than a causation relationship. And the difference is saying two things are related means they occur at the same time, whereas a causation relationship means one causes the other. So it's important to note that they are related, and we don't have a causation relationship defined yet. Interleukin-6 may function as a global marker of impending deterioration in health status in older adults. And so what we're going to talk about here is a study talking about the quality adjusted life years. And the study talks, they're defined as quality life years. So depression can be a life-threatening situation, has been associated with excess mortality and a substantially lower life expectancy. Now this QALYs, and it's a single value index that quantifies the burden of disease. And what that means is that they take a value and they take the quality of life an individual's had for 1 year, and they assign a value to it. And what it means is it reflects then all aspects of health, including non-fatal illness and mortality outcome. So that health utility value is anchored at 0 for death and 1 for perfect health. So to give an example, 1 year lived in a reduced health state of, say, a half is equal to 0.5 QALYs. And that's the same as living 1 year in perfect, as far as 1 year at half health, in perfect health though. So they spend half as much time in perfect health, which is equal to a whole year in half health, just to give you an idea of what they're comparing. And so QALYs was calculated through the remaining lifetime, which is going to be important for us to talk about, because this means that during the remainder of the lifetime, QALY was calculated to be higher in younger individuals. So they have more opportunity to lose quality of life because they have that many more years to live. So this study showed an incremental decrease in QALY, which is the quality of life, with an increased severity of depressive symptoms, as well as significant QALY loss due to mild depression. Nationally representative surveys, it surveys the prevalence of disease, was estimated to be 6.7% in the past 12 months and 16.6% over a lifetime. And as we've discussed, depression is often associated with comorbid conditions and may worsen health outcome. What they used to do this was a 9-item patient health questionnaire, and they used it to measure the severity for depressive disorder and to estimate it. The 9 criteria is based on major depressive disorder or clinical depression, and that's defined as a score greater than 10, whereas the PHQ-9, which is the patient health questionnaire, cutoff of 10 for MDD was moderate, moderately severe, and severe depression. Between 5 and 9 on that score scale was mild depression. And across subgroups with MDD, they had consistently lower QALYs than persons without major depressive disorder. MDD is major depressive disorder. Those with mild depression also had consistent lower QALYs than those with non or minimal depressive symptoms. So if you look at the QALY loss between the ages of 65 and 74 on the top graph, on the left corner, you see that one outlier at 16.9, and those right to the right of it at 75 years. The 75-year-old individuals may have had as much of a decrease in quality of life per year, but as we've talked about earlier, the 65 to 74-year-olds have more to lose as they have more life to live. So a lot of focus has been placed on the sooner you can identify depression, the better off your patient will be. So women were also noted to have higher prevalence of MDD and mild depression, but it was within the range of, or it wasn't outside the range of statistical significance. So it was similar to males, but significantly higher. And the QALY loss due to mild depression was higher for women than for men, but again, was not statistically significant. And I want to make one note on that PHQ-9 scale. It is not a diagnostic tool. It's used as a screening tool for estimating the prevalence of disease. So what we're seeing here is depression is life-threatening. You have a QALY, years lost, and it increases or worsens comorbidities.
So as we just heard, depression is not a small thing, and it's very real, and it can affect every aspect of your life. You're not alone. So let's talk about some things that can help.
So what we're going to talk about is a few clinical solutions to depression, a little bit about those medicines, maybe a few side effects, and how they can help. So SSRIs, which are selective serotonin reuptake inhibitors, they work to increase the amount of serotonin, and they selectively work for this neurohormone, which there are several, but this one's very selective. And this helps the chemicals in our brain to regulate mood and increase the availability in our body. So they need to be taken consistently for about 6 weeks before symptoms will really start to improve. And that would be citalopram, escitalopram, fluoxetine, paroxetine, and sertraline. The good thing about these medicines is they have a very low side effect profile. There are some side effects to discuss with your provider, but if one doesn't work, it's a really easy transition to another one. And most times, at worst case scenario, switching 2 or 3 times to find the one that works for you the best, it's an option. And a lot of people have a lot of success with that. And then we have the SNRIs, which would be serotonin, norepinephrine reuptake inhibitors. And those work to not only increase serotonin, but as well as make norepinephrine more available. And increased norepinephrine levels are thought to improve concentration, increase energy levels, and help the individual just start being more active in their lifestyle. And that would be like desvenlafaxine, duloxetine, and venlafaxine. Now, they are used off-label for other things because they do have other side effects and other things that can be positive or negative. But one thing we want to talk about with SNRIs is with the norepinephrine, you get that increased energy level almost right away in the first week. And what you'll have is a lag of 4 to 5 weeks for that serotonin to start increasing mood and temperament. So if there is any suicidal ideation before starting these meds, that's something that needs to be discussed with your provider, because if they were too depressed to do anything prior, now they have the energy, as well as those suicidal thoughts or ideations are rare, but can happen. So be aware, you have any symptoms of that, it's nothing to be embarrassed of, it happens. Contact your provider, contact your close friend, have a support group, and they'll take care of you. Then you have your atypical antidepressants, the norepinephrine dopamine reuptake inhibitor. Now they increase levels of norepinephrine and dopamine, which again, that's a chemical that regulates mood. And what we're going to see here is that they cause weight loss short term, whereas side effects of SSRIs and SNRIs has mild weight loss as well, but long-term weight gain. And then the atypical ones would be bupropion. We also have what they call tricyclic antidepressants. These are very old school medicines. They work similarly to the ones above, but they are just way less specific. And that would be like amitriptyline and nortriptyline. And these are the ones that you have to just keep an eye on, because since they change so much, they can affect every neurohormone. You have to be aware of how much they're taking. This is a medicine that they have to stay compliant with a lot, all the time. And then we have an electroconvulsive therapy. Well, this is most times considered a last effort, or this is like the end of the line, like we're trying this and nothing else has worked. It's an electrical stimulation of the brain while under anesthesia. It produces a substantial improvement for an extended period of time in about 80% of patients. But there's variability in improvement. While most times there is improvement in the first week and complete remission within 3 to 4 weeks. Again, this is a higher measure. It does come with consequences. Some people notice their personality change a little bit. They're a little bit more subdued for a while. And then we have cognitive behavioral therapy. It's based on the theory that the ways of thinking and behavior are learned, so therefore they can be retaught. And that's something like cognitive restructuring, thought journaling, and mindful meditation. And then we have good old healthy living. You try to find options to reduce stress. Maybe get a membership to the gym and have a friend go with you that can motivate you, appropriate amount of sleep, exercise regularly, like we mentioned, maintain a treatment plan. So regular visits with a therapist and prescription compliance. And what you want to do is make sure you have an appropriate amount of all these, because anything out of the normal range over a long period of time increases chronic stress, leads to further inflammation, and can lead to depression over a longer period of time when you get to the fatigue stage of your body not being able to maintain that higher level of functioning.
Okay, we did briefly talk about this when we talked about depression or barriers to depression earlier. So here are some of those again. Lack of education is one. Some people don't know about mental illness, and this prevents them from seeking help. Then we have that there is a stigma. There's a stigma associated to depression and mental illness as a whole. And so people wouldn't want to label themselves, and therefore that would exclude them from seeking help, or they would exclude themselves from seeking help. Okay, and then there's a scarcity of services. This is simply there being a lack of mental health providers. It is expensive. So for some, the inability to afford proper mental health care is a barrier to getting help in this area. There's also a time requirement. although we have although we might have access to mental health providers, we might not have the time to see them regularly or to fit that into our schedule. And then institutionalization. So this is the fear of being locked in a facility.
So how can you support yourself or someone close to you with depression? So there are many ways to help your loved ones or yourself. When helping others, you can start by reaching out. If they want to talk, be there to listen. Sometimes that person might just need to talk and get things off their chest. If they do share, validate their feelings and reassure them. Even sitting with them in silence shows the other person that you care. And if you're trying to help yourself, getting outside, exercising, spending time with your loved ones, and making an effort to express your feelings are some ways to feel better. So one of the important resources that we have is the Texas Human Health and Services. So this provides access to 37 mental health facilities across Texas. They include services such as cognitive behavioral therapy to reduce the symptoms of mental illness. And they also have skills training and development services to help a person improve skill to participate in the community. We also have other resources to help out. So you can always seek a private therapist. So most of the time they have a sliding scale for cases lacking finances. You can also apply for free therapy through Medicaid, or you can seek in-network first and may turn to a federally qualified health center if insurance is not available.
All right, guys, we urge you, please talk to your healthcare providers if you have any concerns. If you feel like you are recognizing these symptoms in yourself, please go talk to somebody. We want you to get the help that you need. All right, so what we did today, let's kind of do a bit of an overview. So we really we brought awareness to what the problem is. We talked a lot about, how many people are facing depression, what it looks like, things that are going to be, applicable and things that you can take away and actually use that information. There's also we hope to increase the screening for depression. If you recognize these symptoms in yourself or are able to talk to somebody who you are recognizing those symptoms in, we definitely encourage you guys to go get screened for depression and talk to your healthcare providers. Again, with that, we want to increase the treatment of depression. Depression affects your entire life and your entire body, and it's not something that we want to just ignore. So we definitely encourage you guys, go talk to your healthcare providers. We created a dialogue for people to express needs. We definitely hoped that we opened up this conversation and that you are going to be able to talk to others about what you learned today. And we are here talking to you guys and just creating this conversation for such a taboo, or has been a taboo topic. We have given you guys some resources for places you can go to talk to somebody, some information that you can use moving forward. And then also just support. We're here, you have friends, you have your healthcare providers. We are all part of this community together, and we don't want anybody to feel by themselves. So that is just kind of a synopsis of what we did today. Moving forward, we're going to go over some post-presentation questions. So just like those questions that you answered at the beginning of the video, we are asking you to scan this QR code and answer them again for us really quick, just to kind of see what you learned today. And then we have one more QR code for you. If you scan this one, just using your camera on your phone, it'll take you to an infographic that you are welcome to use and keep and print and hand out to whoever you want to. There are some resources and lots of very good information on that. We are so, so grateful that you guys have joined us. We really hope that you learned something and that you're able to use the information that you got from this presentation in your lives moving forward. And if you are experiencing any of these signs or symptoms of depression, please talk to somebody. And I really hope that you're able to get the help that you need. You are not alone, and we are always here. Thank you so much.
Thank you.